We have a new measure this Monday of the surge in severe cases of the flu this season and how hard it's hitting the healthcare system. BC Children's Hospital is seeing so many cases right now. Hospital staff are getting ready to take a new measure to ease the strain on resources. Sick children could be doubled up in single patient rooms. As we first told you last week, BC is reporting at least 6 children have died this flu season. 5 of those were in November alone. And that's a sharp jump from what the province has seen going all the way back to 2015. So we begin our coverage this morning with Natalie Collada following the details out of British Columbia. Notably, Natalie, to start, what are hospital staff in that province now having to consider?
Well, they received a memo, Heather, and it warned staff that they may soon need to keep 2 patients in a single patient room. The memo stating the decision is based on several factors, including the patient's condition, and if that patient has an infection that requires extra precautions, saying the infection prevention and control team will be involved and consulted in making any kind of decision with that. But this is, of course, very concerning. Here's more from the hospital's pediatric infectious disease expert.
If it needs to happen, then we've got the plan in place. So the plan is there if we need to. Generally, because the BC Children's Hospital is designed to have 1 patient for a room, it is definitely our preference to keep 1 patient in a room. It's easier for families and much easier for care, but we've got a strategy so that if we do have to do that, we can do it safely.
Now, to put this into perspective, Heather, for our viewers at home, so far this year, 6 children have died from influenza in that province. According to the hospital, last week, 30 children were admitted with influenza. More than a quarter of those required intensive care. And consider that just last year, there were no flu influenza deaths among children in that province. The coroner at the province saying between 1 and 3 deaths were what they were seeing going back to 2015. So this is very much a sharp increase. So we are seeing action. The province is also urging patients and parents to get their kids the flu shot. They have launched a vaccine blitz on the weekend, hoping to get flu vaccine rates up in that province, because as of last week, only about 20% of kids 6 months to 11 years old had their shot, 15% of teenagers. So there really is a push to try and protect as many of these young people as possible.
Natalie, we know it's not just pediatric hospitals and it's not just in British Columbia. Emergency rooms right across the country are feeling the strain. So as we begin this week, what are hospitals in other regions doing right now? Any new moves to deal with the pressure?
We do know, we're hearing from Newfoundland and Labrador, where officials there are urging parents to do similar to what they're seeing in on the other side of the country in British Columbia, to vaccinate their children against the flu. In that province, less than 10% of the children under 5 have received a flu shot. We have a graph actually to show you to kind of give you an idea of the numbers in the province of Newfoundland and Labrador. The province reports that they're seeing ER visits rise as well. Janeway's Children's Hospital emergency room in St. John's, they say demand there has skyrocketed in less than a month. Daily visits, they say, have jumped from 55 to over 160 visits. We know in Alberta, more than 1,100 people have been hospitalized with the flu. In Manitoba, 7 people have died. And this weekend in Ontario, there were protests, and there are more protests planned for today in several cities, including in Toronto, Niagara, Ottawa, Waterloo, and Windsor. This is all being coordinated in Ontario by the Ontario Health Coalition. They are frustrated with what they're saying. In a news release, they say they've been tracking things like hospital cuts, service closures, and overcrowding for 2 decades and have never seen a crisis like this, where there are so many staffing shortages, intense demand, surgeries canceled, and they are asking for the province of Ontario to do more.